Good afternoon, everyone, and I'm pleased to be here to provide an update on the safe return to school for Alberta's students. Last week, we extended the winter break by 1 week to allow school authorities time to plan in the face of the rapid surge of the Omicron variant. Understandably, school authorities were concerned about issues such as staff absences, not only for teachers, but also for the many other Albertans who support our students, such as bus drivers, teaching assistants, support staff, and administration. Over the past several days, my team and I have continued to work closely with school authorities. I'm extremely grateful for their input, and I'm so pleased to confirm that ECS and kindergarten to grade 12 students will return to classrooms on January 10th. Children who learn in person belong in the classroom, and they will be there with the added safety of rapid tests and medical-grade masks. These will be distributed to schools as an added layer of protection to lower the risk of transmission of the Omicron variant. The government will begin distributing shipments of rapid tests and masks later this week, and all schools will have their initial shipments by the end of next week. Distribution to students and staff will occur as individual schools receive their supplies, and both rapid tests and masks will be shipped in phases. This is on top of the many significant health measures schools already have in place, such as vaccine policies for staff, masking, distancing, and enhanced cleaning measures. In making this decision, we looked very carefully at information from school authorities, as well as health data. We also considered other jurisdictions in Canada who are doing similar things, such as BC and Manitoba. I also want to point out that many other places around the world have been committed to keeping schools open for in-class instruction, with additional measures in place. Take New York City, for example, where students spent last year learning online instead of in person. This year, they are very determined to remain in the classroom despite the Omicron variant surge. Experts across Canada and around the world continue to stress the importance of in-person learning to the overall health of our children and our youth. And I myself have heard overwhelmingly from families that learning in person is best for children. Most children feel more connected, they learn better, and generally thrive when they are at school in person. This is why Alberta's government has placed such a high priority on safe in-classroom instruction and on making sure that our schools have the tools that they need. It's why we've invested more than $1 billion in taxpayer funding to help schools deal with COVID-19, which includes $130 million in COVID mitigation funding for the 21-22 school year. We've also allowed school authorities to access taxpayer-funded reserves, including operating reserves, which have grown to $464 million, an increase of more than $80 million since the pandemic began. This is overall school board operating and capital reserves currently sitting at over $700 million. Again, school board operating and capital reserves sitting at over $700 million. Additionally, as students return to the class, we're helping them get back on track. Students in grades 4 to 9 and their parents will now be able to access free online tutoring resources starting next week. This will help them catch up on important skills and learning that they may have fallen behind on during the pandemic. The e-tutoring hub will be launched with pre-recorded video tutoring sessions on literacy and numeracy that students and their parents can access anytime. And later this year, online tutoring will be expanded to include more subjects and grades, and live tutoring will be offered. Parents, students, and educators are encouraged to try the tool and give us feedback to inform future sessions. It's another crucial step to help students close the gap on pandemic learning, and it builds on our investment of up to $45 million to address COVID-related learning disruptions for students in grades 1 to 3. Finally, Alberta Education is continuing to work closely with school authorities to support shifts that may be required for operational reasons, such as student or staff absences. School authorities will continue to have the flexibility to shift an individual class or grade to short-term at-home learning if needed. While decisions on shifting an entire school or school authority to at-home learning will continue to be approved by the government. Decisions will be made quickly, and consideration will always be given to absenteeism rates and other relevant data, including local health data, if it is available. Again, I'd like to thank everyone in Alberta's education system who is continuing to prepare for the safe return of our students to the classroom next Monday, January 10th. And as I've said before, I'm always so impressed by the resilience shown by our students, our staff, our school boards, and our families in the whole education system. Kudos to all of them. And to the students and everyone who cares for them, thank you for your hard work and perseverance during 2 very tough years. And to the teachers and school staff, thank you for continuing to deliver the world-class education Alberta is known for. Now I will turn it over to Dr. Hinshaw for her update.
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we have identified about 4,752 new cases of COVID-19 and completed about 12,000 tests. Our positivity rate for lab-confirmed cases is 36.9%. Both of these numbers bring us to new record daily highs, underlining the impact of this wave. There are currently 470 people with COVID-19 in hospital, including 72 in the ICU. Sadly, I must announce that 11 new deaths have been reported to Alberta Health over the last 24 hours. My thoughts and sympathies are with the family and friends left behind to mourn these people and anyone who has recently lost a loved one from any cause. I know the rampant spread of Omicron has made this a challenging start to 2022 for many Albertans, including parents, children, teachers, school staff, and administrators, who are all working to do what's best for children in Alberta. Once again, the shifting nature of the virus required us all to pause and reevaluate the best path forward for the second half of the school year. We all know the impacts that being away from the classroom can have on our children's mental health, learning, and social interaction. We know that COVID infection has a low, but not zero, risk for children. We also know that in-person learning is critically important for many kids' educational and social development and can provide a sense of stability and normalcy in these challenging times. There are no perfect, completely risk-free solutions available to us or any jurisdiction around the world, and I believe the provincial approach balances the many competing risks that our children face. The use of rapid testing and medical masks, in addition to the measures already in place, will help to protect students and staff as they return to the classroom. Given the current situation, I also want to note that I strongly recommend that students in all grades wear masks, including kindergarten to grade 3. To keep the risk in schools low, it will be critical for all of us to stay home and keep our children home if any of us have symptoms. I want to remind Albertans that we're in a very different situation today than we were when school started this past fall, or the year before. That's thanks to widely available, safe, effective vaccines and the thousands of staff and students who've been immunized for COVID-19. Now, all children 5 years and older are eligible to be vaccinated against COVID-19. Approximately 85% of youth between the ages of 12 and 17 have received at least 1 vaccine dose, and around 80% have received 2. While children between 5 and 11 have only been eligible for vaccines since late November, 37% have already received at least 1 dose of vaccine. If your child hasn't been vaccinated against COVID-19 yet, I strongly recommend doing so as soon as possible. It is the single most effective tool we have to reduce the risk of infection and severe illness from the virus. A recent publication from the US CDC affirmed the safety of vaccine in 5 to 11-year-olds, looking at 8.7 million doses of vaccine and identifying any significant adverse events such as fever and severe vomiting happening after only 0.001% of all doses. As parents, our first priority is always the safety and well-being of our children, and I understand the need to make the best data-informed decision for them. If you have questions about the vaccine or would like more information, please reach out to a medical professional to get answers. You can talk to your family doctor or pediatrician, call 811, or listen to the Pediatric Vaccine Town Hall recording that's posted on alberta.ca. Since March of 2020, children of all ages have sacrificed a lot to keep others safe. This was especially true in the early months of the pandemic when they missed out on in-person learning, extracurricular activities, and time spent simply being kids. Now that we know more about preventing transmission and we have safe, effective vaccines available to everyone age 5 and older, I believe it is prudent to keep schools open for in-person instruction. However, we all have a role to play in helping to keep schools open and children safe by limiting community transmission. Next to getting vaccinated, the most critical thing we can do is stay home if we're sick, especially even with the mildest of symptoms. Wearing masks and keeping our distance at all times also reduces our risks of spreading the virus, but they cannot eliminate all risks of exposure. This is especially true with the highly transmissible Omicron variant. Each day, parents must complete a health assessment of their children to see if there are any signs of illness, and should do a rapid test a couple of times a week to screen for asymptomatic infection and limit the risk of introducing infection into schools. These steps are critical to limiting exposure in schools and keeping them open. As a parent, I want to say that I understand the mixed emotions that many families may be feeling with today's announcement. As students return to the classroom next week, including my own, I know some parents will be relieved that their kids will get to see their friends and teachers in person again. At the same time, they may be worried about their children's health and well-being or have anxiety over the uncertainties of the new variant. Every family needs to make the right decision for their own situations, knowing that community transmission will continue to be high over at least the next month. The current approach balances the risks all our children face, and each family will need to weigh the impacts of those risks for them. Finally, given the changes we've made to our testing protocols and contact notification process in light of the Omicron variant, I also want to advise Albertans that we will be moving to a different approach for school reporting that reflects the current situation. Similar to other provinces with the growth of COVID-19 cases, Alberta is now focused on investigating cases in high-risk settings, such as continuing care and those who work in healthcare. Other cases, including in students and school staff, will still be notified of their own test result, and they will receive a call to ensure they're aware of their isolation requirements. But AHS will no longer have the capacity to do full case investigations for those non-high-risk cases. As a result of this change, and similar to other provinces, Alberta is assessing different options for an approach to school reporting that reflects the current situation. Details on this will be shared as soon as they are available. There are no easy paths to take in a pandemic, but as has always been critical, we must do our best to look at the whole health of our communities, our families, and our children. Thank you, and we're happy to take questions.